So in 1995, you had an idea of testing THC on children.
It has been known for many years that cannabis can lower the effects of anti-cancer drugs. Anti-cancer drugs, many of them, cause terrible side effects. And in children, unfortunately, children get cancer as well. Children vomit and want to vomit, have nausea. They're really in a bad shape. And they cry all the time. And their parents are in a bad shape. Luckily, most of the children can be cured of the cancer. But the treatment is absolutely difficult. We wanted to do a clinical trial in children. We did that with Professor Avramov. She was head of the Department of Pediatric Oncology in one of the Jerusalem hospitals. And we did a major study with THC given in oily drops under the tongue of children. Obviously, children cannot smoke. We had children that were not even 1 year old. She dropped THC in olive oil under the tongue 2 or 3 times a day, small doses, during the anti-cancer treatment. At the beginning, we wanted to do a double-blind study. Some of the children got the THC, some other children got only the olive oil. After a week, she told me, I'm not going ahead with that. I know exactly who is getting the THC. I know exactly who is not getting it. There was a complete separation. Those that didn't get it continued to vomit. So she went ahead doing an open study, and she gave THC, pure THC, under the tongue about 400 times, which means that those that were involved in the experiment got it every time they were treated with whatever they were being treated. And at the end, we saw that we had complete block of vomiting, complete block of nausea by small amount of THC, which did not cause any psychoactivity, nothing. So here we had a complete therapeutic effect. And we published that. And again, essentially nothing happened. Finito, that was it. It's still not being used in children.
And you think it's a good idea to use it for children?
Well, I believe it's an excellent idea because we help those children that suffer. But I have no influence on oncologists.
If there is a cancer patient who's got pain and that pain is not being controlled well by other kinds of drugs, they're on cancer chemotherapy, they're vomiting, I think it's unethical to withhold a drug from them that can be very useful to help them in their pain management and in their ability to cope with their disease.